laptop arrives, so we don't waste any more time. So okay, when we talk about exercise, so what do you all know about exercise? What do you mean by exercise?
Movements.
Okay. When people say that when you exercise, that okay, I park my car there, I walk every day to my office. I exercise every day.
It's not enough. Certain time or certain period we must cover hours and minutes.
Because there are many misconceptions of exercise. Say that, you know, I park my car very far, I walk every day very far to my office, I still exercise. But exercise, the definition is more of something that you do beyond your normal routine. Something more than what you do in a normal routine. If every day for the last 6 months you've been walking the same distance every day, it's no longer an exercise for your body. Your body has already adapted. So it becomes a routine. So an exercise is something where you put on more extra effort for your body to actually perform. Okay? So exercise is sufficient. I mean it's important. Okay, that we need to have a sufficient amount of exercise every day, because we need movement. We do movement. We need the strength. We need the stamina, the endurance. Okay, we need to endure the body throughout the day. So you need to make sure that you have enough strength, enough stamina, because in exercise you have got a few types. You go on endurance. You go on weightlifting, yep. Okay, that is part of your conditioning, your flexibility, and as well as your balance. Okay, balance is also part of the ingredients that you actually need in an exercise. Okay, when you talk about flexibility, you need to ensure that all your muscles, your joints are all well stretched. It means we do stretching exercises to actually maintain flexibility. Balance. This is helping you to prevent from fall. You know, you don't trip over and fall easily. You can able to balance yourself. You can do a few exercises to actually maintain balance. Okay, like tiptoe, one-sided. You stand on one leg and then you shift. So you try to balance yourself. So this is balance exercises. Aerobic exercises. Things like walking, brisk walking, swimming, garden working, even dancing. All these are aerobic exercises. These are mainly to actually elevate your heart rate. Okay? Then weight training. So weight training mostly is lifting weights. But lifting weights doesn't mean you must go to the gym, you must, push up a few pounds of bottle. No. It's basically adding on resistance for your muscle. Okay? A simple water bottle can actually give you few resistance. You fill in the water, you bring it, do a few push-ups with the water bottle. It gives an additional resistance for your muscles. Okay? But of course, over time, we need to increase the resistance. We cannot have the resistance maintained in a plateau stage. So we need to increase. So aerobics and all will actually help to also maintain your endurance, because it's trained to give you a cardiovascular benefit, to maintain a good blood flow, okay, maintain your musculoskeletal benefits, to make sure that your joints and your muscles are all flexible. Okay. Okay. So it also actually helps with many more other benefits. It helps psychologically, okay, because it helps you to cope with stress. So when you are stressed, when you exercise, you actually release good hormones to actually help you cope with stress. So this actually prevents more of long-term reduction in anxiety and depression. Okay, so these are some of the rewards that you actually get from exercise. Okay. When we talk about patients with liver cirrhosis, okay, liver diseases, they are more prone to have muscle wasting, which are reduction in muscle mass. Okay, so why exercise and how exercise can help with them? Because the capacity of exercise in these patients will be reduced. Okay, so additional exercises can actually improve the overall capacity and the overall fitness of the patient. So this will also help them to actually tolerate better with the medical treatments as well. Okay, apart from exercise, we'll also touch a bit on diet. How diet is also actually important with exercise, because it actually works hand in hand. So you don't only exercise, just because you exercise, I can eat. No, because I'm burning all the fat. No. Okay, so you also have to maintain a certain diet, a good healthy diet, in order for you to maintain your overall health. You need to have fruits, vegetables, whole grains, all this healthy living in order for you to have sufficient minerals and things for your diet. Okay, but patients who may have symptoms like fluid retention may want to actually reduce sodium intake, salt. So those comes mainly like food in canned food and all those. Try to avoid processed foods. Yeah, this increases more. Yeah. Fluid retention, you can control them by elevating. That means let's say your legs are all swollen up. When you sit down, you always elevate them on a stool. Never leave your leg down for too long. Okay, always pump your ankles. So when you pump your ankles, you're actually pumping your muscles. Your muscle is actually like a pump. It actually pumps the blood throughout your body. So the more active that you keep it, the better the regulation of your blood flow. Alright, that's why when you have muscle wasting, your blood flow are actually just slowed down. So exercise actually helps to increase the blood flow as well, to actually pump the blood throughout your circulation.
And if this person walks, like let's say this person is about 80, so if he walks for quite a distance, it will actually hurt the muscle.
It will not hurt the muscle, but it will limit the capacity of the patient. Yes, the distance that you will walk.
Will the muscle pull or tear?
No. It's just the flexibility is reduced. Okay. Right, the topic today, as you all know, is exercising the right way with your body. Okay, you know that why do we exercise? Okay, so it's important that for you to maintain, that's what Dr. Ganesha said, at least 30 minutes a day is optimal. Okay, for you to maintain a healthy living. Now the rewards, as we talked about earlier, your cardiovascular benefits, musculoskeletal, your metabolic rate will increase psychologically, how you cope with stress, and all. So these are some of the rewards that you actually get from exercising. Now, importance. Why is it important? So of course, when you exercise at least 90 minutes per week, you actually reduce the chance of premature death by 20%. So this percentage actually increases the more time that you spend on exercise per week. Okay, so gives you an important of why you need to actually exercise. Okay, now
when you have pain, you're not supposed to exercise. Pain in the body or something.
Pain in the body can be related to either you feel tired, you feel lethargic. Is it why? That's why you need to tackle why you have the pain. Is it that you have specific health problem like back pain or neck pain? for maybe like arthritis, right? When we age, we get arthritis. Arthritis is more like degenerative diseases, you know. So you can actually control them by exercising. Exercising means not only about walking, you know, you also exercise the particular muscles to maintain the joints. Because when it attacks the joints, you get the joint pain. You must ensure that you exercise the group muscles to secure the joint. Because when you exercise, you strengthen the joint. Your arthritis is also well taken care. It delays the process a bit.
But too much of exercise is bad.
Too much of exercise.
No, it wasn't in the papers and the over-exercise.
Over-exercising is probably going beyond what your body can do. That is something that is too much.
Like you run 10 kilometers, you don't run
Yes, it's not that. So it's like, too much is something that, okay, your body can only lift 1 kg, but you are very ambitious to lift 2 kgs. You are actually putting strain to your muscle. So that is a bit too much. So these are the things that you need to know, that what is the right way to actually tackle. Because if you are adding on strain to your body, you might not be able to last. So that's not the right method. So you need to know how much can your body lift before you start doing them. Okay? So it's not only about, you know, building muscles, you know, tuning up your abs and everything. It also makes you happier. Why? Because when you exercise, you've got these feel-good molecules in your body that's being released. So you feel happier, you feel more confident. Okay? As you go on with your daily activities. Okay, this is the types of exercises I spoke about: endurance, strength, balance, and flexibility. So, endurance is more of like aerobic exercises. When you have brisk walking, jogging, swimming, dancing. Okay, strength is lifting weights, alright, resistive trainings. And balance, more of to prevent falls and all this. So flexibility is where we need to do stretching to provide more freedom of movement. That means avoid tightness. You know, you want to actually stretch, but suddenly cannot. One side is a bit tight. So this is where we need to emphasize on stretching, so that when you move, you are able to move freely. Okay, without any tightness. Okay, exercise and okay, the exercise capacity is what we talk about, that is reduced. So muscle wasting is what we will be more prone to, and we want to actually slow down the process. Okay, so that's why exercise comes in to actually help to delay this process, and it also improves your overall outcomes when you exercise, because it actually improves and increases your exercise capacity and as well as your muscle mass. Right, the effect on exercise, of exercise on liver function. So basically your liver operates like an engine, because it needs to actually function like how an engine functions, and how vital is it in your car. So taking care of it is actually very essential. So a good component of regular exercise can actually improve your overall health and have a very positive effect on your overall liver function. Okay, the type of exercise, when you talk about aerobic, what does it do to your liver function? When you do aerobic, your cardiovascular improves. Okay, this has the effect on blood oxygenation. So when you move large muscles like your legs, your arms, okay, it actually speeds up the process of oxygen to all your vital organs. Alright, that's what aerobic mainly does. Now when you talk about weight training, it actually improves overall strength in bones and muscles. Okay. The stronger your bones are, the stronger your muscles will also be. The stronger muscles are, the stronger your bones will become. So maintaining this bone strength will be also vital for women as they are more prone to osteoporosis. Okay, the benefits of exercise. Well, aerobic exercises can actually strengthen your heart muscles. So it allows you to actually pump regularly. So you don't have to have much additional effort. Now, when you have a blood flow that improves, it's actually easier for your heart to get the blood around your liver and your liver to actually cooperate back with your system. Alright? Building some lean muscle mass can actually delay the severe muscle wasting that you actually see them only in advanced stages. Okay? In addition, the weight training also prevents the buildup of excess body fat. When we talk about fatty liver. So all this actually cuts down on the factors. So as I spoke, your exercise and diet has to work hand in hand, balanced. Okay? Doesn't mean that you exercise that you can eat everything that you want. So it doesn't mean that you control your food but you don't exercise, you also don't get the same outcome. It has to come hand in hand. So diet, so why is it important and why we need to take care? People with cirrhosis will have malnutrition, so that's why you need to take care of making sure that they have enough vitamins, minerals and other nutrition to maintain your optimum health. And when you talk about fluid retention, so you need to take a low sodium diet, okay, if that is one of your symptoms. Okay, now we go how to exercise. Okay, when you talk about exercise, the ingredients that you need are a good warm-up, proper conditioning that can contain from your aerobics and your weight training, and a must cool down. We always leave out on the cool down. We don't stretch the muscles after that. That's why we tend to get strains after the exercise. After you go for some exercise, you don't do stretching. So when you don't do stretching, your muscles get a bit sore and all. So this is why, and cool down is important. So these are the ingredients that you need to have when you want to perform, and when you get, this is what you get a great exercise from all these components. Okay, exercising the right way. You need to know what are the precautions that you need to take care. Aerobic exercises and weight training, what are the precautions that you need to know. And exercises versus fatigue, when you feel too tired. Okay, if you are always tired, how can I exercise? So these are the questions that you may want to ask. Okay, the precautions, if you, in advanced stages, you have enlarged veins that can lead to internal bleeding in case they rupture. So you might want to take care and consult the doctor before you start on an exercise regime. And for malnutritioning and muscle wasting, you also want to go on gradual exercise regime to actually avoid yourself to go for something that's too strenuous that you can't cope.
Can you turn back? I want to
Yes.
ask a question. It says enlarged veins in the stomach. What's the symptoms? How do you know you will have enlarged veins in the stomach, esophagus, and what are the symptoms you know is enlarged?
The enlarged veins are not visible.
No,
Yeah.
you will vomit
It's not
blood. If
visible.
you have symptoms, you will vomit blood or
okay.
pass black stools.
Okay,
A lot of
okay.
time people with liver cirrhosis, we would do a scope to see whether you got enlarged veins. The way to detect it before you vomit is actually to do a scope.
From the stools, do you know? Like, is it, you won't know?
Unless you're bleeding, then if it turns black, like tar black stools, then that's a sign you're bleeding.
I read for one talk, it says it must be continuous when you pass motion, it cannot be short like that.
You spoke about that, but it's black, brown, then it's not bleeding. It's uniformly black tar. What it's described typically as has black tarry stools. That means your road tar black. That's a typical, that's bleeding. If you see it's dark brown, a bit of light brown, a bit of black, then that's not bleeding.
Okay. Exercise versus fatigue. Fatigue means lethargic, you feel tired. So it's actually quite common. One thing that when the University of Israel Medical School has actually also warned that inactivity, that means if you don't move about, you actually feel more tired. Okay? But if let's say walking 30 minutes is too much, like for example, you already feel tired, how can I do 30 minutes? So you can actually break down. Instead of doing a one-time 30 minutes, you break down. You do a 10 minutes breakdown 3 times a day. So, because when you do 30 minutes, you can't fulfill the 30 minutes, your exercise capacity, and it's not sufficient for the period of time, you are not doing it effectively. So in order for you to perform a good exercise effectively, you cut it down to 10 minutes. A bout of 10 minutes, you do it 3 times a day. So this is how you can actually spread out in order for you to cope with the exercise. And you still exercise in order for you to not feel too lethargic for your body. Okay? Aerobic exercises. As you know, it increases the efficiency of all your organs. Okay? Reduces your overall body fat. It improves your liver function. So, elevating the heart rate is all the importance that when you get by aerobic exercises. Walking, running, bicycle, dancing, swimming, all these types of aerobic exercises that you can get. Weight training. So when you are prone to develop osteoporosis, especially like women after menopause and all, so when you actually do weight training, you do is because you want to have stronger muscles. The stronger muscles lead to stronger bones. Okay, that's why weight training is useful. And lifting weights can also slow down the process of muscle wasting, which you see in advanced video videos. Okay? Right. Some safety tips that you want to know before you start exercise. Eat lightly, approximately 2 hours before exercise. Avoid caffeine beverages because this caffeine tend to increase your heartbeat, because when you exercise, you want to increase your heart rate. So you want to actually maintain a resting heartbeat before you start an exercise. Wear suitable attire. Yes.
I want to ask, some says taking coffee is very good.
Taking coffee because probably it provides antioxidants, but taking coffee before the exercise is a little bit bad.
Is coffee good for health in general?
It's good for the liver.
Yeah.
Good for the liver.
Good for the liver.
Yeah.
Oh, that's good.
What
And
about
says good for
chocolate?
Alzheimer's.
Alzheimer's.
Yes.
Oh, no, Alzheimer's is good. So if you take 2 or 3 cups a day,
Can.
of coffee,
But it increases the pressure, isn't it?
sorry?
It increases the blood pressure. Coffee.
It can of course give you heart problems, palpitations, certain people. Of course, if it doesn't agree, it's a different story. But if it does, taking a bit of coffee actually slows down the progression for a lot of patients with liver problems.
Oh,
So a bit of coffee is okay, but not before you exercise. So you take it in the morning, that's fine.
is chocolate good? Some it says
Oh, yeah.
chocolate is good.
You know about good or bad, but it comes with a lot of calories. So
Calm you down.
not for the
Calm you
liver.
down, yeah. It's what serotonin?
Like when you go for like England, you go to Kensington Park lah. So
Take chocolate for energy and chocolate.
then you,
dark chocolate.
you cannot go for the food.
So you,
So you
chocolate.
take chocolate bar. I see. Oh, why everybody eat chocolate? So
Probably chocolate gives
Is
you
it-
a quick energy.
Yeah, yeah.
Yeah. But,
Too sweet lah, some chocolate.
not for everyone. Yeah, because individually your responds to frequently.
Because normally we avoid chocolates.
Debatable.
This is debatable.
Debatable.
I love sugar. Or sugarless.
Proper suitable attire.
Oh, yeah.
That's why loose, comfortable clothes is important because you don't want to wear something tight. And then when you want to stretch, cannot, your body is too tight. So you want to have more flexibility when you want to move up your hands, move up your legs. Okay? So proper place. Make sure the place is safe, so that you avoid the risk of fall. Proper weather. Okay? Not too hot, not too cold. Then warm up. So you definitely need to do a bit of a warm up before you start any strenuous activity, any sports in that case as well. Avoid sudden strenuous exertion. Like I said, if your body can't take 2 kgs, don't do 2 kgs straight away. You go gradual. You start with 1 kg and then you move on with 2 kgs as you improve. And always end your exercise session with cool down. Okay? Stretching cool down is very important to actually loosen your muscle after the session.
When you cool down, some people say, don't sit, stand first. Is it true?
Yes. You cool down, you always cool down from like your legs, then you come up to your...
Don't sit. After
Don't sit down.
exercise,
Don't sit down.
Oh,
Because you need to stretch your muscles first before you sit down. Okay, do not exercise if you are ill or unwell. If you feel a bit of a feverish, bit of temperature, maybe you want to take rest, enough fluids for your body, take rest, then you can skip the exercise for the next day. These are the things that you can maybe take into consideration for safety. Okay.
You know exercise you do,
Right. So, to conclusion, regular exercise is actually an important component in fighting liver disease. So for those who are in good shape and exercise on a regular basis, not only feel better, but they also often respond positively to medical treatment. Okay? So to people with liver disease, the benefits of exercising are actually numerous. Alright, thank you.
Roman Henry.
Yes.
What do you mean just now carrying weights, resistant, what do you mean by that?
Lifting weights is adding on resistance for your muscle training.
What do you mean by that?
Like
Resistant,
weightlifting
like
is
push
like
is also resistant.
adding on weights, like even carrying a water bottle
Yeah.
is an additional resistance. So instead of doing a free hand, you
okay.
add on a bit of resistance, you carry it with the bottle.
How long to do that? With the water?
As long as
The
you can.
repetition, no. You do by repetition. Let's say you do about 10 times. Okay. Today you do 10 times, then you do 2 sets of 10 times. Okay? And then as you go on, let's say after 2 weeks, you feel like, okay, 10 times is very easy, or maybe, then you do with maybe add on. You do only 2 sets previously, you do 3 sets. So you add on the frequency and the intensity of the exercises.
What's the weight of the bottle?
Okay. Weight of the bottle, probably if you are unable to judge like how much can you carry, maybe if you take a bottle, okay, just maybe put 1 bottle is probably 1 liter is the big one. The 500 ml, right? So you probably want to put half. Then you see how is the weight. If you feel it's a bit too light, then you're feeling full. But if you want to move on even harder, okay, instead of using dumbbells, you want to use something that you have at home, fill in the water bottle with sand. Okay, then you can fill half, then that on gives a bit more resistance compared to just water. Then you're feeling full as you increase your intensity.
This resistance strengthen the muscle, is it?
Yes.
Oh, okay.
But that's only for the hand, is it?
No. Yes. If
Leg,
you're
how
carrying
about
a
leg?
bottle,
How about leg?
the legs.
Upside down.
Upside down.
Legs, you can actually add on resistance, like if you have ankle weights. If not, you have resistive bands. Okay, you use those bands to actually tie between your legs. Then you try to lift one leg up at a time. That actually increases. Apart from that, it can be also like weight training can also be like you're doing resistance, impact activities like squats.
Lina?
Yes.
You know, sometimes, especially like when you're sleeping, I don't know if anyone here actually has experienced it, but you may sometimes get cramp. You are woken up by cramps.
Yeah.
Is it because you don't have enough exercise, or is it an over-exercise, or is it because of salt intake?
Sometimes it can be because of salt intake. Okay, sometimes
Too
it can
much.
be because if you are a person who's with diabetes, your veins may shrink, so you may get the cramps, especially at night when you're sleeping. This can be like sodium intake is more prominent when you are at an activity or when you're not doing it. You think suddenly if you're driving, you feel, and let's say especially when you're after exercise, if you don't replenish back, you're in more, you're not replenishing back, you might get cramps. So you need to replenish back.
Is it okay if let's say you got a lower back sprain and you still continue doing with some light exercise? Is it okay?
Well, if with back problem, you need to tackle your back problem to make sure that you don't strain your back when you're doing those exercises. Yeah. So you take care of your back, like for example, when you're doing squats, you maintain a flat back. Okay, and then when you can do some back exercises also when you're on your lying down. You can stretch your back first, and then you can do a few exercises with your back lying on the floor or on the bed.
Okay.
So controlling the factors that do not impact too much on your back is also equally important. Okay, so
Will you be showing?
yes. I will have a short exercise demo, probably a short aerobics. We'll do a bit of an exercise to get you all up. Okay, so we'll take about a 5 minutes break, then we'll move on to outside for the exercise. Yes, sir.
Before that, what would you call if a person has this osteoarthritis and what do you call it? The cartilage is worn out,
yes.
things like that. And there is pain and then maybe a torn meniscus or something like that. So when you have a knee condition like that, right? Not to mention about liver cirrhosis, okay? So what kind of vertical exercise can a person do? Because you can't do weights,
Yes.
because of the...
Well, basically with osteoarthritis, if let's say you're talking about the knee, you do reduce the weight bearing. That means you do muscle training in sitting. Like in sitting, there's a few exercises that you can concentrate. In lying down, that you can concentrate. That you're not giving an impact on the joint, but you're strengthening the muscle at the same time. So when you continuously do these exercises, then when you are walking and everything, you can see the impact. When you're like stair climbing and everything, you can see the difference that how does your joint act. Because you are actually strengthening the muscle that is holding up the joint. Because arthritis is something that your cartilage is worn out, your bone to bone is rubbing. Okay, in order to actually avoid this, you strengthen the muscle to hold up. So it reduces the friction that is your arms as well as your legs. Okay, just walk. Let's just walk. Okay, try to just walk. Do it for about 30 seconds. Okay, we are walking on one pace. On the other side. Okay, slow. Loosen your arms, loosen your hands. That's good. Breathe in and out. Slow. Okay. You can't lift up, you just move. Okay, you just move side to side. Something that just from Yes, doing it right. Good. Alright, let's change side. This side. And this side. 10. Good. 3, 4, 5, 6, 7, and 8. 2 more. 9, 10. Good. Ready? Now we go again for your legs. Okay? Now the arm is done, trunk is done. Now it's time for your legs. Okay? Now hold straight. You do squats. You just do 1, 2. Now when you squat, remember your knees shouldn't cross your toes. Okay? You should go back. Push back. 1, 2. If you feel difficult, you're on the chair. At home you have a chair. You do 1, 2. Okay? 3. That's right. 4, 5, 6,
Bend the knee.
7, and 8. Okay, rest. Let us try again. 1, down. 2, very nice one. Okay, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now go on. We go up. 1, 2, 3, 4. You can do on the same sides or you can change sides. Okay, 1, 2, 3, 4, and 5. Let's repeat that one more time for your right. 1, 2, 3, 4, 5. Good. Change side to your left. 1, 2. Just go as much as you can. You don't have to lift them very high. Just as much as you can. 4 and 5. Okay, good. Can feel those legs already, right? Okay, now we go for your calf. Okay, how to strengthen your calf, your ankle. Now you tiptoe and then you start. Okay, lift your leg. Stand on your toes. Try to stand on your toes and down. For those who you can't do this yet, just stand on your toes and down. Stand on your toes and down. Very good. Stand on your toes and down. For those who can do more, stand on your toes and alternates. Yes, good. Stand on your toes and down. It's very important for you to strengthen your calf. Okay, on your toes. Up and down. Up and down. Up and down. Up and down. Good. Okay? Alright, let go freely. Now for those who you want to do at home, you can't do squats on the chair. You lean on the wall. Okay? You have a wall. Okay, you put yourself there. Push backwards. Come down. Slide up. Slide yourself down on the wall. Slide up. Okay? You can choose a wall if you want to try. Okay? Grab a wall. Lean. Every exercise has to end with a cool down. Okay? Now we'll start on with the legs. Now open your feet a bit. One leg forward. Okay? One leg bend. Try to just bend. Push. One leg is straight. The forward leg is straight. Put your hands on the opposite leg. Yes. Feel the stretch. Bring out your toes as you feel them. Just stay straight. Can you feel the stretch at the back? Yes. Can you feel the stretch at the back? Yes. See this leg bend. This leg bend, this leg straight. Okay. Bend this leg. Can you feel here? Bring up. Put your hand here. Both hands. Yes. Can you feel the stretch? Yes. Don't open so wide. Don't open so wide. Little bit only. Little bit only. Don't open so. Straighten one leg and you push on the bended leg. Make sure your toes are coming up. feel the stretch at the back. Okay? It's the same method you are doing in sitting. Same thing in standing and sitting. Okay? Now we go to your hips. Let's turn your hips. And move the ball. And turn this way. Good. Relax your hips. Good. Now hold both your hands together. Push yourself forward. Feel at the shoulders and your back. 1, 2, 3, 4, 5, 6, 7, 8. Release. Bring your hands back and push yourself back. A little bit. 1, 2, 3, 4, 5, 6, 7, 8. Good. Forward again. Go. 1, 2, 3, 4, 5, 6, 7, 8. Push yourself back. 1, 2, 3, 4, 5, 6, 7, 8. Very good. Now bring your arms. Push in. Your arm. 1, 2, 3, 4, 5, 6, 7, 8. Change. To your left. Cross forward. 1, 2, 3, 4, 5, 6, 7, 8. Good. Bring your hands up. Bring it back. Push one hand down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Change. 1, 2, 3, 4, 5, 6, 7, 8. Good. Free. Now let's go to your neck. Hold it. Push up your neck. Push. Hold it there. Look up. 1, 2, 3, 4, 5, 6, 7, 8. Good. And down. Hold it down. 1, 2, 3, 4, 5, 6, 7, 8. Good. Bend your knee. Bring your head to the side. 1, 2, 3, 4, 5, 6. And to the side. Good. 1, 2, 3, 4, 5, 6, 7, 8. Good. Now take a deep breath and breathe out.